Welcome to Bandaging the World, updates on the COVID-19 pandemic, presented by Shilpi Shah
And Ayan Caillou.
on behalf of the Orchid organization.
In our presentation, we're going to be going over 4 topics. What exactly is COVID-19? Where's the COVID-19 vaccine? How to prevent COVID-19? And how are the countries holding up?
As aforementioned, the first topic we will be discussing is what exactly is COVID-19. So let's learn a bit more about the virus that has quite literally taken the world by storm. First, we will be discussing the structure of the virus. It is important to first note that viruses have a different molecular structure than bacteria. They have an additional layer than bacteria, which is what makes antibiotics such as penicillin ineffective. However, what is unique about the COVID-19 virus, one of the reasons why it is called a coronavirus, is due to the spike proteins on its surface. It is called a coronavirus because these spike proteins look like a crown, which is English for the Latin term corona. These spike proteins make this virus highly transmissible, and it aids the virus in initial attachment to the host, which is one of the reasons why it is able to bounce so quickly from host to host. This virus is genetically similar to the virus that caused the SARS outbreak in the Middle East in the early 2000s, as both of these viruses are part of the coronavirus family. What type of virus is this? This virus is a respiratory virus that attacks the lungs and chest area. Most of the vulnerable populations are those over the age of 60, so those that are the elderly population, and those whose immune systems are already compromised by pre-existing medical conditions or by autoimmune disorders. However, it is also important to note that children are the group that are most likely to have this virus asymptomatically. Mechanism of action. The coronavirus begins in type 2 lung cells because, as aforementioned, it is a respiratory virus. From there, it can wreak havoc on the immune system, which can ultimately lead to long-term lung damage or even death. Something that is also interesting to note about this virus is that it has a fairly different set of genes than most other coronaviruses, which offers the virus an advantage, however, is not very beneficial to us humans who are being afflicted by the virus, as it makes finding a treatment for it extremely difficult. Something else that is interesting to note about this virus is the fact that it prefers to infect the ACE2 protein, which is the protein that, interestingly enough, regulates blood pressure, which is something that may not have been thought to be something that would be correlated to a respiratory virus. However, it is, which can lead to the proposal as to should we be examining the relationship between blood pressure and this virus. However, that's a topic for another time. Symptoms of COVID-19. Many people have already searched this up. However, the symptoms of this virus can be fevers, body aches, coughs, lack of smell or taste, shortness of breath, sore throat, and all around simply flu-like symptoms. However, this virus can also sometimes cause a viral form of pneumonia, as aforementioned, in the more vulnerable populations such as the elderly and those with autoimmune disorders, which is actually the leading cause of death by COVID-19. What exactly are the transmission methods of this virus? So the most common transmission methods for this novel coronavirus are direct and indirect contact, which means that any type of object that has been touched by someone who is a potential carrier of this virus can be considered a vector, which is a vehicle of transmission for a virus to move from a host to another host. This is another way as to why this virus is so highly transmissible, because of the fact that it can be so easily transmitted from indirect contact. Oftentimes the lifespan of this virus can be up to 2 weeks, which is why when receiving objects from the mail, people should be careful when touching them, as they could potentially receive the virus from touching objects that have come from foreign places. It is also important to note that recently this virus has also become airborne because the virus can be transmitted through droplets that remain in the air, which can then be inhaled, which is one of the reasons why it has now been recommended for cloth face masks to be worn. However, that is something that will be delved into a bit later. It is also important to note that this virus, among the rest of the viruses in the coronavirus family, is not bloodborne, which means that Donating blood or having blood transfusions during this time is not does not have any danger posed to it by the coronavirus. When it comes to the risk for this virus, no one has been found to be naturally immune to the virus, which technically means that everyone is at risk. Children are least likely to have a fatal outcome. How, However, elder adults, smokers, and other users of addictive substances, whether that had been in their past or in the present, and those with existing medical conditions have the highest risk of fatality, especially those with autoimmune disorders who take medication to strengthen their immune system to be more careful when determining whether something is a foreign invader. While while populations with already compromised immune systems are the ones that have the most risk, that does not mean that there is not a risk of fatality for healthy people. A common effect of COVID-19 in healthy patients is cytokine storms, which is a phenomena where the body responds too strongly to foreign invaders and sends an overwhelming amount of cytokines, which is a sort of mobility mechanism, that places that area to be targeted by antibodies and other of the body's natural defense systems. These overwhelming amount of cytokines are mostly centered towards being sent to the lungs, as that is what is being most directly affected by this virus. However, they can also be sent to surrounding organs and other organs in general, as they can be sent out to the body in general. So these storms do affect many more organs than just the lungs, which is what often causes healthy people to be in need of intensive care, as many of their organs will need to be cared for. So then this poses the question, why exactly is this so dangerous and fatal? Oftentimes, this virus is asymptomatic, which means that people will not even realize that they have the virus due to the fact that they are not showing any symptoms of it, which means that they'll feel that they are safe enough to go out and go communicate with others, which can unfortunately transmit the virus. Even when the virus is not asymptomatic in patient, it will take approximately 2 weeks or at the very least 5 to 6 days before symptoms will begin to show, which poses the same problem. And not only can people transmit it when they are being asymptomatic, it is easily transmissible for the reasons that were stated before, due to the fact of the spike proteins that are on the surface of the virus. And also because of those proteins, this virus has a very long lifespan without a host. It can last up to 2 weeks on certain objects. And unfortunately, one of the main reasons as to why this virus has become so fatal is because none of the treatments that have been tested are working. Most so far have had absolutely no effect.
Which brings upon us the prominent question, where's the COVID-19 vaccine? So let's take a minute to discuss the status of the vaccine that'll stop the pandemic. So why a vaccine? A vaccine would prepare the bodies of people to the virus, which would prevent the infection and spread in the process. If the virus stopped in its tracks, cases would drop instantly, resuming normal life. So vaccines for other diseases historically have worked the same way. For chickenpox, HPV, hepatitis A and B, measles, polio, cases instantly fell to near zero thanks to vaccines, which is all reliable science. Now, the development of a vaccine usually takes 12 to 18 months if we're being optimistic. The world record fastest was 4 years. And the reason for this length is to assure safety and functionality. Can a vaccine be developed? Can a vaccine even be developed for this virus? Does it remain effective over periods of times, years? Is it safe for people to use? The success rate is extremely low for new vaccines that are developed. Less than 10% of drugs that enter clinical trials were approved by the FDA for public use, according to Vox. And all of this basically comes to say that a vaccine isn't coming anytime soon. Now, this leads us to how we can prevent COVID-19. So according to the World Health Organization, there are 5 key traits that help prevent COVID-19. 1, stay home as much as you can. 2, keep a safe distance. 3, wash your hands often. 4, cover your cough. And if you're sick, call ahead. Now, staying home stops you from encountering anyone who could have the virus. Keeping a safe distance stops the virus from going on to people or things, which is why you have to stay at least 6 feet apart. Washing your hands rids it of the virus, which is why you have to wash your hands with soap and water for 20 seconds, or hand sanitizer that's at least 60% alcohol. And you have to cover your cough using a face cloth, and napkins and tissues. Getting rid of napkins and tissues right after you use them, immediately after a cough or sneeze, and sick calling gives people a warning ahead of time.
Let's delve into how are the countries holding up. So let's delve into the updated statistics of the virus around the world. This is a map by the Center of Science and Engineering of Johns Hopkins University and its specific resource center on coronavirus stats. As quite distinguishable, the United States still has an extremely large number in comparison to the other parts of the world. However, the numbers have begun to decrease in Asia, which was the originating country. However, they're still extremely prominent in Europe and have begun to grow more prominent in South America. As of late, there have been 6,973,195 total cases that have been confirmed throughout the world, with over 1 million of those being within the United States. This chart shows the mortality rates of patients from the COVID-19 pandemic in different countries, with the highest rates being in France, medium rate being in America, and the lowest rates being in South Africa, Pakistan, Bangladesh, Russia, and Chile. And this concludes our presentation on the updates of the COVID-19 pandemic. We hope you're all staying safe and doing well during this tumultuous time for our world.
Yep. Thank you guys so much for watching. I hope you guys share and spread this video. And yeah.